You'll see the note pop up.
Good afternoon, friends. Welcome to another edition of COVID Community Conversation, where we bring you face-to-face with people who are integral parts of the process, plans and solutions for COVID-19 in Aurora. You know, we often talk about the front lines and those who fight for us. What I realized over this time is how much we take our healthcare professionals for granted. You know, we don't necessarily always recognize their true value simply because we don't see them every day. Yet they are open and working for us every single day of the year. Today, well, this pandemic has shined the spotlight on our medical institutions and those that work behind those doors to keep us safe. So today, we look behind the scenes of Aurora's two primary medical centers, Rush-Copley and AMITA Health Medical Centers. If you grew up in Aurora, we simply knew them as Copley and Mercy back in the day. Matter of fact, I was born at Copley back in 1970 when it was in the middle of downtown, well, right off the downtown Aurora, and I went to Mercy a number of times over the years when I'd have scrapes. And I appreciate you gentlemen meeting with us today and to talk about the issues with COVID. We have today with us the president and CEO of each medical center, Richard Roehr from AMITA Mercy, and lifetime Auroran John Diederich from Rush-Copley. How you gentlemen doing?
Great, thank you.
Good to see you today. Now I'm going to ask you, gentlemen. You know, I gave some introductions, but I don't think I did you justice. And you know, I don't want you to toot your own horns, but I'm going to ask you to introduce the people and tell them exactly who you are. We'll start with you, Rich. But you know, tell people who you are and what your job really is every day.
So, you know, today it's a little bit different than it used to be many years ago. To be a president and CEO today in a hospital, it's really frontline operations, you know, and AMITA, for those who don't know, is part of a very large healthcare organization and with parent organizations across the nation. So we do a lot of really good work nationally. We do really a lot of good work from the system. So we're really out here as operations, running the day-to-day operations, growing the business, watching the markets, working with the physicians directly, and making sure our leadership teams are the best they can be. So been around this market for about 25 years, which is good. Used to live in Aurora, now live in Yorkville. So very, very protective of my market like you all are. So really looking to take Mercy to the next level.
Absolutely. Absolutely. And you mentioned your team a little bit. You want to, you know, who are some of the, what are some of the positions and team players that make the hospital move forward?
Well, really, it's the frontline leaders that make the hospital move forward. Those are the people that are on the front lines every single day. I think John would agree with me. We don't sit here in a suit behind a desk and claim to own what happens here every day. The people that come in here every day that check in, punch the clock, and come into this very difficult situation, they need to be recognized. And the community has been fantastic in recognizing these folks. You know, our senior leadership teams, we work tirelessly behind the scenes to support them, make sure that the supplies they need, and make sure they have the tools they need to do their job, and really watch what's going on around them and in the community so we can protect what we're doing. It is tough work right now, but we're handling it very well.
Absolutely. Thank you. Well, thanks for coming on, Rich. Appreciate it.
Yep.
John, tell us a little bit about who you are, brother, your background and who you work for.
Well, I'm John Diederich. I've worked for Rush-Copley Medical Center. I'm president and CEO. You know, Rush-Copley's been caring for patients in Aurora for 134 years, since 1886, when we were first founded on Lincoln Avenue. We've been at this location on Ogden for 25 years, believe it or not. We still call it the new hospital, but it's been 25 years since 1995 since we moved to this location. And we've been affiliated with the Rush System for Health since 1987. The Rush System is made up of Rush-Copley, Rush University Medical Center. Most people know it as the tower down on Congress in Chicago, Rush Oak Park Hospital, and also Rush University. Richard, as you know, I grew up on the east side of Aurora, attended Marmion Academy, so I'm a local guy. Started at Copley when I was a young cadet at Marmion. When I went to college, I came back to my hometown hospital to begin my professional career when we were planning the move of the old hospital to this location on Ogden Avenue. So I've been here since the beginning of this location. I worked in the financial area of the hospital, some of the revenue cycle areas, and I joined the executive team in 2002, became Chief Operating Officer in 2006. And after 13 years as the Chief Operating Officer, I was appointed the CEO in November, just last November. So this is my first task, a pandemic, you know. So,
Wow.
yeah, so it's been pretty interesting. So my total tenure with Copley has been 35 years, believe it or not. I know that's hard to believe when you look how young I look, you know, but 35 years.
I know.
So, right?
I was thinking that, brother, as you
Yeah.
mentioned it.
Both Rich and I had hair when we started this pandemic, you know. So.
You got to be bald to be a CEO today.
That's right.
It's mandatory.
Yeah.
Well, thank you for coming on. And before we get into it, let me ask you, and I'll start with you, Rich. How many heroes you got working there for you at Mercy?
We have roughly about 750 associates.
Okay. All right.
Which is a pretty good number. We're not as large as others in the community, but we do a pretty nice job.
You know, I call them heroes and heroines because of the great work that we've seen our medical personnel do, you know, over this crisis. And I mean, selfless and putting themselves in harm's way in many occasions to make sure that our community and everybody else, you know, is taken care of and is healthy. How many heroes you got working for you, John?
We have 2,600 employees here at Rush-Copley. We have the hospital, of course, but we also have the medical group. We've got the Healthplex, which is a large fitness center. And I think we are now the largest employer in the second largest state in Illinois. So proud of that fact.
Well, we're proud to have you in Aurora, brother. So, gentlemen, let's get into a little COVID talk, you know, because as you both pointed out, these are different times, and based on the circumstances, it seems like you're almost different hospitals than you were just 3-4 months ago. So, you know, let me ask you, we'll start with you, John. When did you get your first COVID patient? And how many patients have you treated, would you say?
Sure. We first knew, you know, COVID was coming through our integration and affiliation with Rush University. So we knew it was just a matter of time. We received our first COVID patient on St. Patty's Day, actually, March 17th. Since then, we've cared for 551 COVID patients, and probably those that are positive, and then another several hundred more that were either negative or what we call PUIs, persons under investigation. So many times people come to the hospital, it might take a few days to get the test results back, but we treat them as if they had COVID, just for the protection of our employees and for the protection of our patients. But yeah, 551, either through the ER, you know, through our physician practices or inpatients as well. Currently, we have 54 positive patients, COVID positive in our hospital. 5 of them are on ventilators, and we've had about 52 to 60 patients roughly for the last couple of weeks. So we're still at a peak point at Rush-Copley.
So when you say peak point, that means it hasn't dropped yet or hasn't flattened as we hear that needs to happen on the news?
No, every time I think that we're going to see the curve coming down, we hit another peak. On Easter Sunday, we were at 43 patients, down from about 58, and I thought, this is it. You know, now it's coming down. We've got it. And then about 7 to 10 days after Easter, we saw another spike, and took us up to about 60 patients. And as we dove deep into some of those patients, we found out that we had, from 2 families, we had 11 of our 60 patients came from those 2 families.
Wow.
And the one thing they had in common was that they all gathered on Easter. And when they gathered on Easter, all of a sudden we saw that spike here at Rush-Copley. I know Rich has seen similar patterns over at Mercy.
Yeah, Rich, yeah, man, you know, that's a shame for that family. Rich, when did you get your first COVID patient, and how many patients have you treated?
Sure, Richard. I remember it like it was yesterday. It was March 10th. You know, we saw many PUIs, and we cleared a lot of people, and we kept knocking on wood. We did this for 2-3 weeks and said, well, we keep testing negative. Maybe we're going to miss it. But March 10th, we got our first patient. Since then, we've seen about 280 COVID positive patients.
Wow.
We've evaluated close to 800. So it's been relatively busy. Like John, we've seen peaks and valleys. I'd say just before Easter, I think John would agree. I thought we saw a plateau. Yep. Then we got some holidays and some warm weather thrown in, and things start to change. So We're sitting on probably 39, I believe we have today, with 5 on vents. But we've got a high population of persons under investigation. So we've got about 18 of those, depending on how they convert. But 2 of those are already vented. So even those persons under investigation, today it seems like people are afraid to come into hospitals. But as we're getting them, they're coming in with a very high acuity level. So by the time they come in, they're already very sick, which is unfortunate. And we're hoping to change that a little bit.
Wow. So it sounds like to me, if both of you still are peaking, that this is far from over. This is far from over what you're dealing with.
Far from over. Yeah, definitely. Yeah.
Wow.
It's really going to be important. We've got to take what we've learned in the last 60 days during the lockdowns. And I think people have gotten smart. We've done a lot of training. We've done a lot of education. But if we really want to see the end of this, we've got to continue to practice what we're learning through this process. Otherwise, we're just going to keep seeing those peaks and valleys. And the last thing we want to see is a reemergence of COVID-19.
Now, John, you had mentioned, and Rich said the same thing, that you've got about 5 people on ventilators. What exactly does that mean?
Well, it means that they can't breathe on their own. So that's been a big part of this whole disease. It attacks the lungs. And if you can't breathe on your own, you have to be put on a ventilator. And early talk, if you remember, out in New York was they might not have enough ventilators. Luckily, both Rich and I at Copley and Mercy have enough ventilators to take care of our patients. We only have 5 at each institution, but we have many more ventilators available than that. Hopefully we won't have to use them.
Wow.
Yeah, I think in addition to that too, I think both of our institutions being part of larger systems, I think when we watched what was happening in New York and in other countries, I think we adapted to the proning protocols early on, which avoids the use of ventilators very quickly. So that's helped a lot. We've never gotten to a point where we're going to run out of ventilators, which is good. Right. And I think we're both fortunate in the fact that we're part of larger systems where we were able to manage resources around our system. So if we were a standalone hospital, which means that Mercy was just Mercy, we may have had an issue, but because we're part of a larger system, we are very resource rich, which is a very big value to this organization and to this community.
John, you just said that, and I asked the question, what does that mean when a patient goes on a ventilator? You said that means they can't breathe on their own. So, but for that ventilator breathing for them, they would pass away.
Absolutely. Yeah, absolutely. Ventilators are the life support. That's when people talk about life support, you're on a ventilator, and it's helping you breathe and doing the breathing for you. And the goal is to, number 1, keep people off the ventilators. And then number 2, once they're on a ventilator, do everything we can to get them off the ventilator so they can breathe on their own and get better and get back to, living their life.
And this, Rich, is because of a virus, COVID-19, that stops a person from breathing.
Yeah, it is a respiratory-based virus, and part of what makes this disease just difficult to handle is because, unlike the flu, it gets in your lungs, and it does cause you, for many, difficult breathing. Now, not everybody's responding the same to it. You yourself have gone through this experience, and I heard you state many times you felt that struggle to breathe.
Absolutely.
And I would tell you that what we're finding is people who have other underlying conditions like asthma or whatever, it's those folks that are more susceptible to this. And those are the people that typically wind up on ventilator, or people that are elderly in age, and those types of folks. So it's a challenge.
Now, this is a terrible virus, and it's so novel coronavirus. It's so new that we don't know what to expect in these circumstances. Now, unfortunately, and I expect in both your cases, there are folks that go on the ventilator that helps them to breathe, and this can't make it back off the ventilator. Has that been the case, John, with you? Have there been people that actually passed away from COVID?
Yeah, unfortunately, we've had a lot of good stories, and a lot of people have left the hospital. We've had over 140 people that we've taken care of and have been able to get better and leave the hospital. And we've done clap outs for them, and it's been really inspiring for the staff and for those families and patients. But yes, we have had 17 deaths at Rush-Copley due to COVID, and that's unfortunate. This is a terrible disease, and half of those deaths have happened in the last 2 weeks. So it's been really hard on our ICU staff who've been caring for these patients for weeks and weeks. I mean, sometimes up to 30 days that they've been sitting in our, laying in our ICU, and our staff, our physicians, our nurses, our respiratory therapists, they're doing everything they can to save these people and get them off the ventilators. But it's been a challenge, and it's been really hard emotionally on them, for sure.
What about you, Rich?
Yeah,
what are your circumstances?
Much of the same. We've lost, unfortunately, 19 people to this virus. It's roughly a little more than 8% of those that we've treated. It is very unfortunate, and to watch this happen is unfortunate. And and that's what we want to talk about today, is really how do we prevent this from happening, and really tell the story about what we can do as a community to do the right things to keep this. Because certainly what we're doing nationally and locally is we really want to flatten that curve. And I know we've put a lot of protocols in place, and I think there's still some opportunity for governance in local gathering places or places that see a lot of people, like large food stores. So, we tell people we want them to wear masks in public, but when you go into a food store, I was just in one over the weekend, and maybe 1/3 of the people are wearing masks. And, and they kind of look at you like you're looking goofy because you got a mask on, and it doesn't make sense to me. This is a very serious pandemic, and we're going to see the result of how serious we take it today.
Yeah.
Yep.
And John, let me you had said something, that your staff, the frontline nurses, doctors, when someone has to deal with being on a ventilator and unfortunately doesn't make it off at times, that it's very hard on your people there. And
Yes.
is it one part because it's almost like they become the surrogate family to these patients, because the family can't come into the hospital with these patients?
That's right. Both Rich and I were faced with some of the most heart-wrenching decisions, and one of the biggest ones was implementing a no visitors policy. And that seems to be relatively easy given what's going on with the pandemic, but that is heart-wrenching to be able to not be able to come visit a loved one who is in that situation. It's brutal. It's brutal on the family. It's brutal on the patient. And like you said, Mayor Irvin, those caregivers become the surrogate families for those patients. And when they lose those patients, it's hard on them, just like they lost their own loved one. They form bonds with these patients. They bring the iPads to the patient's bedside to say, here's your family. And they're that conduit, that facilitator to the family. And they become very emotionally attached, as they always do. And it's not just COVID, but especially with COVID, they become very emotionally attached to these patients as they try to nurse them back to health.
Are you seeing some of the same things, Rich?
Yes, we are. And I would tell you, Richard, that, it's very emotional just watching the staff's reaction to some of this, because as John said, they become attached to some of these patients. We've had some of our frontline caregivers, particularly in the ICU, reading a patient's favorite book because the family can't get in to do that, or relaying messages. And again, like what John is saying, we've implemented iPads and telehealth and all kinds of ways that we can keep families connected to their patients. And not only COVID patients, you have to understand we still have a great deal of regular medical patients, and those people can't have visitors either. Only in certain circumstances, either where a child's born or somebody's getting ready to pass away, and we will screen them, and in just those circumstances, we'll let them come in. But it's really about the protection of everybody in the community.
Absolutely. And Rich, let me start with you. How has your hospital procedure changed? I mean, what's the process of a person coming into the hospital that might have COVID now?
Well, the process right now is the same for everybody. We implemented a while back where the staff come in. We have a dedicated entrance for staff. We have a dedicated entrance for visitors. We've shut down some of our entrances, including our main lobby entrance. But if you were to come in our hospital today, you would get a series of questions. It's mandated that you gel your hands, and you're going to get a temperature check, and then you're going to get handed a mask that you must wear the entire time you're in the hospital.
Wow.
So it's a significant change, and that applies for anybody, even the mailman.
Wow. What about you, John? Has that
Yeah, same thing.
The policy change.
Same thing. We went from like 11 entrances to 3 at our hospital, where every patient, every employee, every medical staff member has to get a temperature check, has to check in, has to be wearing a mask anywhere in the hospital. In our ER department, we've instituted, I know Rich did this as well, a forward triage process where in our vestibule, before you even hit the door, you get screened for any type of flu-like symptoms. And if you have any type of flu-like symptoms, you're actually sent to a separate area. For a long time, we had tents up in our ambulance bay that, influenza-like illnesses and potential COVID patients would then be screened there to keep them separate from the rest of the, standard ER patients. The tent process actually has, we're not using that right now, but they still go to a separate area of the ER where they're segregated off from the rest of the hospital to make sure that we contain that virus. But that's one of the things that we've implemented here at Copley.
Wow. I mean, with COVID going on right now and all the precautions you're needing to take to protect the health of everyone, because not everyone that comes to the hospital has COVID. Is that right?
That's right.
And then not everybody's coming, to even check to see if they have COVID. There's still other hospital things that went on before COVID that still need to go on. Is that right?
Well, Richard, to that point, I mean, we both mentioned I have 54 COVID patients right now, but we have 186 patients in the hospital. So that's still, it's a big chunk of our patients, but we still are treating patients like we do day in and day out, 365 days a year here at Copley and at Mercy.
What about you, Rich?
Yeah, the emergencies don't stop. And, that's one thing that if we can get a message out to the community, if you're experiencing a need for medical attention, seek that attention. The hospital is probably one of the safest places you can be right now. The processes we have set up in our hospitals today, we are very intentional about keeping our COVID patients separate from our clean patients. Again, John will tell you the same thing. We don't want people to wait and experience difficulty outside the hospital. And we're seeing that nationally. We're hearing numbers 25 to 30% of a drop in patients seeking medical attention for stroke and heart attack. That's scary.
Wow.
Yeah.
And you know what, John?
Can I jump on that real quick?
Please do.
So same thing. We typically, before COVID, pre-COVID, we had about 180 patients a day come through our ER. Okay, that was a typical day at Copley. Since COVID, at least through April, we're seeing about 101 patients a day. That's like a 45% drop in patients through our ER. And that was on purpose, somewhat, because we wanted to free up those beds in our units. But what was happening was, I think there was a pent up demand, as Rich said, people now are coming to the ER for more serious illnesses that maybe they weren't seeking out care before. We're up to about 130 patients a day, but those patients are much sicker than the 180 we were seeing pre-COVID. They're coming with more comorbid conditions, complicated things, not just the earaches and the bumps and the bruises and things like that. These are sick patients, and it's been really hard on our ER staff to be able to, adjust to, big volumes, then smaller volumes, and then sicker, more acute volumes. So it's been a challenge for our team.
Well, let me follow up on that. Rich, you had said something, the hospital is the safest place to be right now. So can you tell the community, our community listeners right now, is it safe to come to the hospital? Let me just qualify that for a second. Because COVID's going on and we all know that COVID patients are going, if I have something that is not COVID related, I'm having heart problems, or I need to get stitches, or, maybe I'm scared to come to the hospital because I don't want to run into somebody who might have COVID and I get COVID myself. So is that why people are sicker, because they're waiting till the last minute to come to the hospital?
That's exactly right. And the hospital, just to reiterate, is very, very safe to come in. If you're experiencing an emergent need for medicine, you should come to the hospital. And I would tell you that you're more likely to get COVID from hitting a handrail on something outside, or hitting a door on a building that is not being managed the way we manage our hospitals. So the risk is there. And I would also tell you, to go back to what John, where he left off, here's where we're seeing the real challenge. So as we said, people are waiting longer to come into the hospital. And by the time they get to us, they are far more sick than they normally would be. So the acuity level has gone up.
Gotcha.
What happens there is that because they come in with a higher acuity level, they're staying longer. So our average length of stay went from like 3.5 days. We're up to about 7.5 days on average. So what that tells you is when your discharges come in and you're not, or your admits come in, you're not discharging them fast enough. That's why our census has gone up. As you heard John say, he's got 180 something patients in his hospital. I got 140 in mine, and only less than 50% of those are COVID patients. So that's how that results.
And if I can
Please,
also tag on to what Rich was saying about safest place to be is a hospital. I mean, I truly believe that. I walk around this hospital every single day, and our caregiver, number one, we don't have any visitors here. We have very little public at all, which makes it, it's kind of a ghost town when you walk around some of our waiting rooms and lobbies and whatnot. So it's just staff. But those staff, they're so good about, washing their hands, wearing their mask, wearing scrubs. They're taking their temperatures twice a day. They have to have their temperature checked before they come in here. I believe that the hospital is one of the safest places in the community to be. We were out shopping the other day, my wife and I, and she saw the anxiety in my face as we're walking through the grocery store. I said, I'm going to get COVID here before I'm going to get it at the hospital. I guarantee it. Again, nothing that they were doing that were wrong, but people had families there, not wearing masks, not social distancing. And that was very unnerving for me. And I feel much safer coming to the hospital every day than being out in just general public areas right now.
Absolutely agree.
So the general message you would want to say to a person feeling sick is don't wait to the last minute. And people do that normally. They usually wait till, they're feeling real bad before they come. So the message that you want to send out to our public is don't wait. If you're sick, seek medical attention.
Yep, that's right. Please don't wait. Don't put yourself at any more risk than you need to.
Right.
Yep. And the hospital's a safe place to be. Come to our ER. If you have a non-COVID situation, you'll be in a separate area, and you'll be taken care of just like you always have been.
Absolutely. All right. Now, let me ask you, gentlemen. Now, I'll start with Rich. On May 11th, elective procedures are allowed again. What does that look like for you when you start doing elective?
Yep.
First, what is an elective procedure? So just everybody is aware.
Well, an elective procedure is a non-emergent procedure. So it's something you may want to get done that you don't necessarily have to have done.
Gotcha.
And the good news is, we partner with our physicians. They are the ultimate decision makers. John and I as administrators don't make those decisions. And the physicians partner with their patients to decide when is the right time to get a procedure done. So on May 11th, IDPH has said we can begin to do elective procedures. However, we have to meet certain criteria. I think for us at this point, and I think, John, you may be in the same course, we're meeting that criteria. However, there's such a pent-up demand for urgent business right now. I can tell you next week, May 11th starts on Monday. Next week, we have met our criteria for what we're going to allow on week 1 for elective procedures. And most of it, I'd say 90% of it's actually urgent procedures right now, just to catch with the pent-up demand. So that's where we're headed.
Just to add on to that, so there are 3 categories for the types of surgeries that can be done. There are emergency surgeries, which are those immediate life-saving surgeries, which have never gone away. We've always been in business for that. There are, as Rich said, the urgent elective surgeries. Those might be things that if we delay any longer, the progression of the disease could become problematic. So it might be a suspicious lump or some extreme pain that somebody's in. Those are the things that we are going to open up, at least incrementally, starting on May 11th. And then there's also the third category, which are what I call the elective surgeries, something that can wait. Maybe it's something cosmetic, maybe it's a knee replacement that isn't imminent. Those things are going to wait for some time as we get through the pent-up demand for those urgent elective cases to make sure that our community is getting their needs met so that they don't have a disease or an illness that progresses to a worse condition. And as Rich said, we also have to, before we start having inpatient cases being done, we have to meet some very strict criteria by the state of Illinois and the Illinois Department of Public Health. And it's a good, I agree with these rules. We have to have 20% of our ICU beds open. We have to have 20% of our med-surg beds open and available. We have to have 20% of our ventilators available, and our PPE supplies have to be in good shape before we start allowing inpatient cases to be handled at the hospital. And then the reason for that is if we have another surge of COVID patients, we have to make sure we can handle that peak. And I think that's really important. So we're starting with outpatient procedures. I know Mercy's starting with outpatient urgent procedures, and then we'll see how it goes and then ramp up from there, working with our medical staff and also our administrators in the surgical areas.
Absolutely. Gentlemen, it may be a while before we ever get back to what we can call normal, if ever again. There are a lot of things that will never go back to the way they were based on what we've learned for COVID. And once we come up with a vaccine for COVID or some type of treatment, this will pass. But you got to be prepared for what might happen next. What does your hospital, Rich, look like post-COVID in the future? What are you going to do differently from this point on?
Yeah, everything that we've planned for up to this point, we're going to continue on as long as needed. I don't see this going away anytime soon. I think everybody across the state and across the country is looking for that sort of backslide where this thing starts to lay down a little bit. But until there's a valid vaccine out there, and that's been widely distributed, much like a flu vaccine, we're going to live with this for a very long time to come. And, I would tell you, even going back into these elective and somewhat emergent cases, there are other standards that we're putting into place to further protect the general public. For example, for an elective case, if you want to come in for a procedure, you now have to have a COVID test within 72 hours of that procedure being done as an additional layer of protection to make sure that we're not bringing more risk in and sending more risk out into the community. So I think this is going to last for a very long time, Rich. And, I don't have a magic 8-ball. I don't think anybody does. I think what we're trying to do is really just follow the rules that we're given and really be socially responsible to get this thing to lay down as much as we can. But, the fear is we got summer coming along. We got big venues. People are wondering, if concerts and football games and baseball games are going to start up. I think it's way too early to go down that path. So I like the staged approach that I'm hearing. I trust it and I believe in it. And from a hospital's perspective, I'm going to support it.
And that only applies, the stage approach you talk about was Illinois governor's stage approach. That only applies to Illinois. So if, let's say, somebody flies to another state that doesn't have the same approach to things and just opens the doors, you're still going to be dealing with when they fly home and how they could, just like you said, John, go to a family gathering and infect everybody there.
That's right.
So how do you deal? How do you deal with that, John? Where this is in flux, constantly moving parts.
Yeah, there's going to be a new normal. There's no doubt about it. As Rich said, we're going to be moving toward more of that screening before you come to the hospital, making sure you don't have any symptoms, make sure you're testing negative for COVID. Taking temperatures before you enter the building, limiting the number of patients that we have. It's going to be that type of thing. And we're looking at social distancing in our waiting rooms, taking out chairs, staggering the way we book people. We used to just pack them in, we can't do that anymore. We have to do it in a more staged approach. And even now, even the way we see patients, patients don't need to come to the hospital anymore. They can see their physicians via a video visit, or they can skip the waiting room altogether and do all their registration and all their consents online, and then walk right into the doctor's office when they get here. So the way healthcare is provided is going to change over the short term here for sure.
Wow. And some of the practices you're putting in place, if they're good, you'll continue those, from this point on. Yep. I would think, yeah. You both said that it doesn't seem like this will be going on for a while. There's no light that we see yet at the end of the tunnel until we have, some proven vaccine or some type of mitigating treatment for this. As just an average person, and a citizen, resident in the city of Aurora or surrounding communities, what can we do to protect ourselves, to make sure that we don't fill your hospitals and we don't continually get sick? John, let's start with you.
Well, it's just not getting lazy on the practices. I mean, we have to stay home. Obviously, you need to go out for some reasons to get supplies, to get food. But when you do that, make sure you're having good, safe practices. Make sure you're wearing a mask. Make sure you're social distancing. If you're sick, please stay home. You're just infecting people. And just respect people out there. I've just seen a lot of people in the community just getting kind of, I don't know, crabby or, just not very friendly. We need to remember, we're all in this together. We're all working together, and let's help each other. And let's not, put each other down. And I've been in some stores where people are upset with the long lines and different things, and it's demoralizing. And we really got to help each other and pick each other up in these strange times.
What about you, Rich?
That's absolutely right. I think I'm seeing the same level of impatience that you're seeing, John. People want to get back to work. People are losing their businesses. There's a lot of fear of what this is going to look like in the future. And I speak to the group on this chat, not only from a hospital administrator, but I'm a father as well. I have 2 teenage daughters. And let me tell you how hard that is to keep them. They want to go out and they want to be with their friends. I have a senior who's graduating this year, and we're still waiting for details of when she can graduate. And I get that. I mean, for the class of this year, they're sort of getting cheated a little bit. And there's a lot of things happening. There's, you watch the news, people have big weddings planned for this season. I understand all that. I get all that, but it's important to keep the course, keep the focus, because that's really going to determine how long this is really going to last. And the better we can flatten this out, the better we can take what we've learned and get back out into the community, out in society, and begin to maybe go back to restaurants. They will be socially distanced, which is okay. But we've got to do the work today to get there tomorrow.
Yeah, John, let me ask, we hear a lot, stay at home, practice social distancing, make sure that you constantly wash your hands, and which you should have been doing, anyway, but, even more so than you had before, use hand sanitizer as much as you can. From a hospital's perspective, how does a resident staying at home and using protective measures help the hospitals and your team? How does that really help?
Well, it's just helping, mitigate the spread of disease. I mean, by doing that, you're respecting the healthcare worker by not spreading it, by not putting them at risk, having more patients come in with that same situation. And I see it as an issue of respect and honor of our healthcare workers. So the more that people can do their part, the more they're protecting our frontline staff.
What about you, Rich?
Yeah, I'd say, Richard, I think, the big impact right now is our healthcare workers. They're getting tired. They're doing a lot of work. As we continue to see more COVID, these folks are taking up hospital beds, and not that we don't want to treat them, but if we can get this to where we can slow this down, then we can get people in the community to start coming back to the hospitals and getting the treatment early on rather than waiting. So, we're using a lot of resources. Just turn on any channel any time of the day, and you'll see the shortages nationally for PPE, the challenges with staffing. So that's really where the people in the community can help, is to help support the hospitals by paying attention, practicing social distancing, the hand washing, the masking, and let this thing slow down a little bit, and so we all get a breather.
You both pointed out, your nurses, frontline folks, and the hospital personnel that are coming in contact with not just your COVID patients, but also the other patients that come to the hospital that normally would always come to the hospital for healthcare services. What do you want people to know about your doctors, your nurses, and your staff that are caring for the people, John? What do you want them to know about these folks?
I always tell our team that we have 3 goals. The first goal is to take care of our patients, COVID or not COVID, and make sure that they're getting the best quality care and safe care. Second goal is to protect our healthcare workers. Okay, that's so important. And the third goal is to ensure the long-term stability of our organization. But when it comes to the healthcare workers, I've just seen what our team has done, and I'm in complete awe of what they have done. Our physicians, our nurses, our respiratory therapists, pharmacists, phlebotomists, housekeeping, dietary, you can go on and on. I mean, everybody has just stepped up, and I'm just so proud of them. And they're being presented a challenge that's the professional challenge of their careers. And they are truly the heroes. They're running towards the danger to protect our community from the danger. And I'm just so proud of them. And it's been rough. I won't lie. I mean, early on, I think everyone was kind of jazzed up, like, let's go do this. We're ready. And after 60 days or so, it's tiring. It's exhausting. And we have to keep the morale up with our team. I'm sure Rich is feeling the same way. And we do that in a variety of ways, but it's not easy. It's not easy for them. And I respect them so much in terms of how they're embracing their profession and taking care of our community.
What about you, Rich? What do you say your doctors, nurses, and healthcare professionals?
Yes, much of the same, what John relayed there. I would tell you across the board, we've got a dedicated professional group of doctors and nurses, and not just doctors and nurses, respiratory care therapists, the housekeeper that goes in the room, everybody who comes in these doors every single day is part of that team. And we recognize internally that we can't be successful unless everybody's driving down the same path in the same direction. So, the recognition that we've gotten from the community and from patrons, restaurants, bringing us food and taking care of us. We've had people dropping off homemade masks, hair clips, so the skin behind your ears doesn't get raw and infected from wearing a mask every day. It's been absolutely heartwarming to see how the community stood up to support us.
Yeah, can I chime in on that too? I mean, the community support, as Rich said, has just been unbelievable. I mean, we've gotten so many food deliveries, cupcakes, cards. The emergency first responders from Aurora and Kane County came and did a parade at both hospitals with lights and sirens. That was very uplifting for our teams. We've got an artist here at Rush-Copley painting flowers in our windows. Jose Art, I think he did some work for the city of Aurora. He's doing a great job. That's been inspiring for our staff. The prayers for our teams that have been put out there, just a tremendous outpouring of support from our community, from our board, from everyone. That's really been the silver lining in this whole thing, just seeing a community come together and see a healthcare community come together to address an issue that's just been unprecedented in these times.
Both of you guys mentioned, and I had never considered it until just right now, that, this COVID situation, when it hit your hospitals, everybody was gung-ho and saying, we got this, we're going to fight this. But after 2 months go by, 3 months go by, and you're still seeing these peaks, and they're still dealing with, folks on respirators and folks passing away, unfortunately, and they're becoming surrogate family members because your family can't come to the hospital. Man, what can we do as a community to encourage them and make sure that, even though I know they're getting tired, that we're there for them, and we want to show more support for them and make sure they can make it through this. I mean, we complain because we have to stay, in the house. We don't get to go to a restaurant or a club that we like because of all this stuff, and we're tired of dealing with it. But they are tired because they're actually working and doing and making sure they protect the community. What more can we do and we should do more? What more can we do to encourage them? We'll start with you, Rich.
I think what's already happened, just to continue that, would be fantastic. We see people lined up and saluting nurses and doctors and healthcare workers when they come into work. We see that when they leave. We've got signs posted outside. As John said, we've had the siren parade come through by police and fire, which was fantastic. I think I saw more tears that day by our healthcare workers, just to show them that emotional support from the community. So I don't know that there's anything new or different to do other than to keep up what we're already doing and keep showing that support. And if I say there's anything different, is to continue to challenge the message that we're sending today to the people in the community to really practice safe social distancing and be socially adjust, because that's what's really going to help. Again, we're all tired. Every day we're tired, and we're both sitting on very high volumes in our hospitals. So there's no shortage of people who are ill, but we need a break.
And one strange repercussion of this whole thing is everyone's wearing masks and you can't see people smile,
Right.
and that's been really a weird thing to think about, but it's been, when someone comes to the hospital in the ER or any area, we're smiling at them. Hopefully the patients are smiling at us, but you don't see that. And so you almost have to go above and beyond both ways, not just the caregivers of what we always do, making sure we have a good patient experience and treating people with respect, but also the patients treating the healthcare workers with respect when they're here. And, you might think you're smiling at somebody, but they can't see it. We even have staff that sometimes draw smiles on their mask to, show them that we're smiling at them and going above and beyond for our patients. And, that's one thing I could ask our patients to do is be patient with our staff and smile back at them and smile with your eyes, smile with your words. But it's a different time. We have to socially interact a little differently than we have in the past.
Absolutely. Absolutely. This is such an interesting subject, and I know we've got a lot of folks that are watching this that probably have some questions for you. Clayton, can you let us know if there are any questions from the audience?
Most definitely. Well, community, by and large, as we see, cheering you all on, cheering the healthcare heroes on, saying thank you for your service. Let's go to a couple media questions. Jason Addy from the Aurora Patch wants to know, are you comfortable with your PPE supplies?
John, we'll start with you.
That's a good question. PPE has been a hot topic across the industry, across the nation. Right now, we are comfortable with our PPE supplies. I never say it's perfect. We always say we conserve PPE, not because there's a shortage, but because we don't want there to be a shortage. So we're very careful in terms of how we dole out PPE. When patients come to the hospital, we want them to bring their own masks because we want to save those surgical masks and those N95 masks for our employees and our caregivers. So that's one thing that we keep an eye on. Recently, just to show a partnership with the community, the Aurora Fire Department needed some N95 masks, and we had a pretty good supply, and we traded them. And we were short on gowns, and the Aurora Fire Department had gowns. So we traded them some N95 masks for some of their gowns, and that's the way we work together. As Rich pointed out too, we also both of us have the benefit of being part of a larger system. And that gives us some buying power and some sourcing that maybe we wouldn't have otherwise if we were still standalone hospitals in Aurora. So that's been a benefit of being part of a system. But having said that, as we start to open up, more cases, more urgent and elective cases, that's going to start to drain our PPE because we have to protect our employees and our patients from any type of cross-contamination there. So we're keeping a very close eye on it every single day. Every single morning, we have a PPE report from our purchasing department, our materials management department, to make sure that we have the proper protection for our employees.
What about you, Rich? Proper PPE?
Yes, absolutely. Much of the same. As John said, AMITA Health, we're a very large healthcare system here in the state of Illinois, and that allows us to transfer resources across our system. We do manage that every day. We have a call every morning with in excess of 200 people, doctors and nurses and senior leadership across the organization to decide where those resources go every single day. So we've been fortunate there. I would tell you the other reason we're fortunate is, one of our sister hospitals here, we were the first recipient of the first COVID patient in the state. And I think we learned early on, and we've devised ways to manage our PPE internally. So, if you were to come around my ICU today, typical equipment that you would see inside of a patient room, like pumps and IV bags, are outside the patient room. So we don't have to keep going back and forth in that room to exhaust the use of PPE. We supply longer lines to keep that stuff outside and minimize the exposure and minimize the use of PPE. So we've done very, very well. I don't know, as John said, if I'll ever be comfortable,
right?
Because you just don't know where your next delivery is coming from. But right now in our system, we have a stabilized process for managing. We actually track it by the day for the system, and we've got many, many days on hand, in some cases 20, 30, 40 days of PPE on hand.
And Richard, if I could say, it's been great that we've done this sheltering in place and we have bent the curve, because if we didn't, Rich and I would be having troubles with PPE. So we've been able to stretch this thing out and be able to manage the surge so that our supply chain can catch up with the demands on the PPE. So I want to say kudos to you and the city government and to the residents of Aurora that they've done their job to help us manage this crisis.
Yeah, I'd like to jump onto that too. You know, from a community perspective, I can't thank this community enough. Aurora has seen crisis before and has managed through and managed it well. And, you know, through this process, we've seen in multiple areas where we could have seen larger outbreaks, but the right authority stepped in at the right times and helped to mitigate that. That could have put a significant strain on both of our hospitals, but because you know, you all and the health department jumped in at the right time and took some action, it was a salvation for all of us. So thank you very much for that. It doesn't go unrecognized.
Absolutely. Next question, Clayton.
Sarah Freitag for the Beacon News. How are hospitals handling nursing home patients? When they no longer need hospital care, are they sending them back to the nursing homes, or what happens in that process?
Rich, we'll let you start with that one.
Sure, absolutely. We see our fair share of nursing home patients. I would tell you that alongside with us, our nursing home administrators and nursing teams out there have learned from this process just as we have. I think pretty much across the board, we're getting a little bit more comfortable. We certainly will take the patients in if it's medically necessary, whether they're COVID or not. And as we discharge patients back to a nursing home, I believe the standard now is it John, 2 positive tests?
2 negatives.
Take those patients back. So they tend not to have the capabilities that we have as a larger healthcare organization to isolate those patients. So it's a partnership. And we talk and we work together, and that's how it gets resolved.
John?
Yeah, nursing homes are obviously an area of risk for the healthcare community just because of the nature of what they do and the vulnerable population that they have. And we work very closely, as Rich does, with our local nursing homes. We have case managers that work closely because, you know, nursing home sends patients to us when people are acutely ill, and we want to send them back, you know, in a better shape back to the nursing home in a safe way. And Rich is right. We have to have 2 negative tests before they take the patient back, and we want them to have 2 negative tests because we don't want to send a patient back to the nursing home that's sick and has COVID and then spreads it to the nursing home. Now we got a bigger problem. So we work very closely in collaboration with our long-term care facilities in the area.
Absolutely.
Next question, Clayton.
Another question, Sarah with the Beacon News. What are your current ICU capacity rates? You talked a little bit about ventilator usage earlier, but can you talk about that as well? If you hit the peak for that as well.
John?
Sure. So our ICU is a 22-bed ICU, and early on, we got pretty busy pretty fast in the ICU, and we've been working with the Rush system on some predictive modeling, which is basically an algorithm that takes into account, you know, spread rates throughout the region, number of patients hitting our ED, you know, the infection rate, and it predicts almost like a weather forecast in the next 5 to 10 days. How many patients are we going to see and have to care for in our ICU? And as we were looking at those surge projections and that predictive model, we realized 22-bed ICU may not be enough. And so what we did was we took another unit, our intermediate care area, which is typically a step-down unit for cardiology patients, and we converted it to an ICU, a second ICU, a non-COVID ICU, which allows us to take those ICU patients that were typically in our main ICU that were non-COVID, put them in the other unit, which expanded our capacity by, I think, 16 beds or so. And now our main ICU is a COVID ICU, and it's fluctuated up and down, but we have plenty of capacity today, knock on wood. At some point, we might collapse it back, but we're not there yet. We want to make sure we have enough ICU beds to maintain the best care for our COVID patients. But right now, we're in good shape.
Rich?
Yeah, much of the same. We have a 16-bed ICU unit here. We're running about 70% capacity COVID positive patients there. We also have a dedicated floor on our 5th floor of the hospital where our original ICU used to be years ago. So we have an additional set of rooms up there that we utilize for ICU as well. But that entire floor is either COVID or patients under investigation. So that's the ability we're able to isolate with that floor. But our ICU so far has been good. Really, what drives it is the use of ventilators and innovation. So we've been fortunate, again, earlier, as I mentioned, using that proning protocol. It's helped us a great deal. So we're doing pretty good right now. And ventilators, we have plenty. And again, if we ever get close to that edge, being part of that large system, we can relocate ventilators throughout the state.
Next question, Clay.
Final question. Every day we see hospitals having to deal with the challenge of employees testing positive for COVID. Have you had to face that experience here in Aurora?
Rich, we'll start with you.
Yeah, I would tell you probably every healthcare organization in the country right now has had that experience. We have protocols in place. If we have employees who are symptomatic, we isolate, self-monitor, we watch that. And right now at Mercy, we haven't had a significant challenge. We've had a couple of folks, and typically the way it happens is this. So if we get a patient who comes in, we suspect COVID, we test for COVID, and sometimes that test comes back negative. Again, we rely on our physicians heavily to say, well, we're not really kind of believing that first test. Let's run a second test, and that second test or even that third test may come back positive. Then you have to go back and trace every interaction that patient's had and all the different employees and keep those records. So it's a daunting task. We've become fairly good at it, unfortunately. But at Mercy, we've been fairly fortunate where we haven't had a significant impact of COVID positive employees.
Go ahead, Clay.
We'll test it to John as well.
Oh, John.
I can comment. Sorry, I can comment on that. Yeah, we have had some employees who have tested positive for COVID. Luckily, knock on wood, none of them are hospitalized. They're at home. They're under the care of our employee health service and getting the proper treatment and proper care from our teams. And what has happened is, that hurts your workforce, right? You take those people out of the bedside and you have to backfill those positions. And one of the reasons why we canceled some of the elective procedures so that we could have the nursing staff and the physicians and the support staff to be able to backfill some of those positions with folks that are willing to work, willing to step up. It takes a team, and soon we'll have those caregivers back that have tested positive.
Thank you.
Last question. Go ahead. You said no more question?
Yeah, that was the final question. Thank you.
Okay, thank you very much. Jim, I just want to say thank you very much for agreeing to come on. Everything that you've talked about today, was impactful and something that we can take away and implement. John, something that you said that, I think that I'll take with me and use, that same philosophy, is to make sure we show people that we're smiling. So Clayton, I know we're going to be ordering a whole lot of surgical masks. If we can get a few of them with a big old smile on it, that would make a difference.
Yeah.
A lot of the things that we all take for granted, a smile, a handshake, a hug, are things that we're not going to be able to do. If we're wearing out in public our face coverings and masks, people won't be able to see a smile. You won't be able to run up to someone you haven't seen in a while and give them a hug, or even when you see somebody that you see all the time, but whenever you see each other, you normally greet them, with a handshake. We won't be able to do that, for a while. But,
Right.
What in that, affects our community, but when you hear you guys talk about what you and your healthcare professionals are going through every day to continually protect our community, that gives us hope that although we're not through this yet, and it may be a while before we get there, we've got people like you looking out for us and that have our back. So I just want to send a big shout out to all your doctors, all your nurses, all your healthcare staff, and say, job well done. We know you're tired, and we know that you're hanging in there and you're going to continue to work for us, and thank you for everything you do, because without you, it could be a whole heck of a lot worse here, in the city of Aurora, and we don't ever want to see it. You get worse. We still are climbing those peaks, and fortunately, hopefully, we'll be able to see, some decline. You level off for, at least those 14 days of decline, with both the governor and the White House say we need to see before we move on to the next stages of health in our community. but, just knowing that you guys, are the foundation of our healthcare system, lets me know that we're going to be all right in the end. We're going to be all right. So I just want to thank you again for coming on.
Can I say another
Absolutely.
word? Okay.
Absolutely.
Well, we kind of focus on the hospitals today, and that's great. Thank you for giving us that forum. But I want to thank caregivers throughout Aurora, not just at the hospitals, but also at the VNA, at Advocate Dreyer, at the King County Health Department. There's so many, they're independent practitioners. There's so many healthcare providers in the Aurora community and beyond. We're all working together as one healthcare community, and this is Nurses Week, and I just want to say a shout out to all the nurses throughout the community. No matter what organization you work for, we appreciate you and thank you for everything that you're doing.
Yeah, I'd like to jump onto that as well. Particularly police and fire, you all are out there fighting on those streets every day. EMS folks, you're bringing those people into us. You're facing the same exposure that we are. And all I would encourage you to do is find a way to celebrate. I know you guys can't experience this live as we do. The highlight of a nurse's day or a healthcare worker's day is when we discharge patients every day. We call that code celebration. That gives that person who's been on shift almost 12 hours a time to come down in the lobby and actually listen to a prayer over a patient as we're walking them out the door because they've survived COVID, and hearing that applause. To hear that every day gives us reason and course to come back to work every single day and continue doing what we do. So my message to you all out there as public servants and people in the community, find a way to celebrate. As John said, find a way to smile, show your gratitude, show your thanks. It's no more important than it is today right now.
Gentlemen, you guys do a great service to our community. Thank you very much for coming on. We got Richard Roehr from AMITA Mercy and John Diederich from Rush-Copley. Thank you, gentlemen. We'll see you next time. Bye now.
Thank you, Mayor. Appreciate it.
Absolutely.